Patients sometimes ask me, what are the bad results from surgery? Which of course I respond, I don't know, I don't get them. But in all honesty, we all get some degree of complications, but I think the bad results they're talking about is the things that come in from poor planning and poor design and poor execution of what you're supposed to be doing. So in the face, maybe starting top to bottom, brows that are pulled too high up, giving people the surprise look. This comes from not knowing exactly where a brow is supposed to sit when you're planning a brow lift. Eyelid surgery, two big things we often see. Too much skin being taken out of the eyelids. This requires very precise measurement. Again, this is where millimeters turn into miles. If you take too much out, sometimes people just look like they've had a triple, quadruple espresso. They have that wide-eyed look. Sometimes it can be functional problems, especially on the lower lid. We get lid pull downs or lids that turn out. And unfortunately, lid complications are sometimes very difficult to treat. And the best way to treat them is by not getting them. So when we do our eye lifts, we don't try to go after every possible wrinkle at the risk of creating a complication. Talking about this in the consultation process, again, helps us avoid this by setting a proper expectation and not having the patient expect the surgeon is going to be a cowboy in surgery and try to pull as hard as they can. Facelift complications, again, occur because of lack of understanding of where things should be pulled to and how hard they should be pulled. So the answer to the facelift is not just pulling everything straight back like this. Of course, people come into a consult and they're like, hey, can you do this? Yeah, I can do that, but the cheek's got to go up, the jowl's got to go 45 degrees, the neck's got to go straight back. The submental area or underneath the chin has to come up this way. We have to create a 90-degree angle this way. So again, there's a lot of different parts of the face, and each one is treated individually, so the final result is excellent. The mouth, another way to see a facelift not done well. Sometimes, people smile and they're like Julia Roberts ×5. The smile comes way out to here. So again, when we do a facelift, we make sure that we respect the function of the eyes, the mouth, and those things continue to function normally after the lift. And we don't pull or suspend or do something that distorts that area of the body. Finally, scars, the way things look around the ear, the way things will look after you heal. We see what's called pixie ear deformity. If people pull this up too tight but don't suspend properly, as it heals, it pulls back and pulls the ear down, and we get an ear that looks like Dr. Spock from Star Trek. Again, a telltale sign of a facelift that's gone bad. Sometimes scars. Obviously, with all plastic surgery, we try to hide scars in contours and shadows, so they're not very noticeable. Sometimes in facelift, we see huge back cuts that go into the hairline that are absolutely visible. Sometimes we see hair loss from scarring, from scars from facelifts. Sometimes overaggressive surgery, not only pulling, but maybe underneath the chin, where people have liposuction every last ounce of fat, and you start seeing the muscles and the contours of things underneath the neck, which we in the profession we call Cobra neck, where it's overly caved out. So again, everything is about moderation, and that doesn't mean not doing a full lift. That means putting everything exactly where it needs to be in exactly the proper measure of how much you need to take it out. And this is the way we avoid somebody looking at one of our patients saying, oh my God, what happened to them? And we'd rather hear, oh my God, what happened? Did you lose weight? You look rested? Did you go on vacation? Not who's your surgeon, although I encourage my patients to tell people my name. So anyway, bad facelifts, again, in summary, generally the result of poor planning, poor execution, and we avoid that by trying to do it right from the beginning.